It really is all about making connections so we can promote each other's work. All right, here we go. All right. Well, we are nearing the end of our time together. And as we do at each of these forums, we have a nomination process that's been going on for the past few months for the Annie Hall Award for Centering the Family Experience. And so I want to share a little bit of information about Annie for those of you who did not have the pleasure and joy of knowing her personally. I'm gonna try not to cry, but whenever I talk about Annie, I cry a bit. Okay. So Anne Marie Hall, she passed away February 9th, 2021, after a valiant 7.5-year battle with metastatic breast cancer. Annie graduated from Grosse Pointe High School in 1994. She was excellent in academics as well as athletics. She was named 1994's Female Scholar Athlete and Most Dedicated Female Athlete of the Year. She was also named 1994 Conference MVP in track and field. Annie graduated from the University of Michigan in 1998 and Michigan State University College of Human Medicine in 2005. She completed her residency in internal medicine and pediatrics, the University of Minnesota in 2009, and a fellowship in neonatal and perinatal medicine at the University of Colorado here in 2012. Between 2012 and 2017, she was an assistant professor of neonatology at the University of Minnesota. And in 2017, Annie returned here to Colorado, where she was a neonatologist at Children's Hospital of Colorado and spent most of her time at Poudre Valley Hospital in Fort Collins. And she was an assistant professor of pediatrics here at the University of Colorado School of Medicine. And the reason that we developed this award in her honor is that Annie truly loved engaging with families of the babies that she cared for in the NICU. She felt a deep conviction that family-centered care was critical to the health and well-being of our high-risk infants and their families. And in 2017, Annie joined the steering committee of the Colorado Hospital Substance Exposed Newborn Quality Improvement Collaborative and led efforts to optimize the safe discharge of substance-exposed newborns from hospital to home. She worked real closely with many of us, multidisciplinary members in clinical care, public health, and child welfare to develop plans of safe care, which we're now, integrating into our clinical care units. So this award in Annie's honor and memory recognizes an individual or a team who seeks to center the family experience and the provision of medical and social care for pregnant persons and infants in the Rocky Mountain region. And it's really my pleasure to announce that this year's awardee is Erin Mestis. So I'm going to say a few words about Erin, and I hope that she will say a few words as well. So Erin has worked in the NICU for 18 years and has been a neonatal nurse practitioner with Children's Hospital Colorado for the last 8 years. She works primarily at Poudre Valley Hospital in Fort Collins in their level 3 NICU. And Erin has served a variety of roles and committees related to safety and quality, neonatal resuscitation, debriefing, and delivery room care of infants and their birthing parents. Erin is a wife as well as a mother to 4 children, ages 8 to 19. 3 of her children are NICU graduates, including 29-week boy-girl twins and a daughter with Down syndrome. Those prenatal, birth, and NICU experiences greatly influence her practice and her commitment to providing family-centered care. Her quality improvement efforts have included a multi-year project aimed at defining and then implementing best practices in the care of infants with Down syndrome and their families from diagnosis through hospital discharge. Erin's also on clinical faculty at Regis University, where she guest lectures about Down syndrome, outcomes, parent experiences, and communication related to delivering that diagnosis. She also represents Children's Hospital Colorado on a national level as a content expert. She has served as an NRP instructor for 15 years, enjoys precepting NNP students and fellows, as well as family medicine residents. She's published works on congenital CMV and neonatal physical assessments. And I think Erin worked with Annie directly, and I'll let Erin speak to that. But, really in thinking about this year's nominations, we really couldn't think of anyone who really embodies the spirit of Annie and how much she loved families and really gave her heart and soul to supporting them. So thank you, Erin. Get this out of your way.
As Susan said, sorry. I worked very closely with Annie, and she was a very good friend as well. I could not be more honored to accept an award that was created in her memory. Annie was a remarkable human being, and she was a remarkable physician, and her ability to make every family feel like they were the center of our day and our work and our intentions was probably her greatest strength, which is saying a lot because she had a lot of strengths. The work that I have been able to do specifically with families who are expecting a baby with Down syndrome was born from my own experience. And in my own sort of patient tracer of myself and identifying we were doing a good job. We were, but we could do a better job. And what does that look like for families? And how do we achieve that and accomplish that? And I feel like so much of Annie's passion for what she was doing and so much of her, the work that she did with moms, I know so much of that in her heart was rooted in her fear and maybe some knowledge that her time as a mother was potentially limited. I feel really lucky in that the work that I've done specifically with families who are expecting a baby with Down syndrome or have had a baby with Down syndrome, we made some really big changes that had big effects in our community and required engagement and involvement and commitment and buy-in from our medical director, and then all of our other neonatologists, the NNPs, our multidisciplinary teams, everyone in our NICU, and then community players too. And I think what we were able to accomplish in a relatively short period of time and then continuing to make improvements to that process make me so proud to be a member of this team, and so proud of the work that we do, and so proud of everyone here and everyone who continues to show up and ask. We're doing a good job, we are, but how do we do better, and what do we need to do to accomplish that? So thank you so much.
Okay, and so here we are, 3 o'clock is upon us. I really hope that you all, both in person and virtually, feel that your time with us was truly well spent, that you feel motivated, inspired, educated to now go forth and get to work. The questions we have to ask and answer: how can we better serve our babies and families? How can we better support our staff? And how can we disseminate and sustain? How do we avoid burnout? We are so passionate, and I know we all are not just working 1.0 FTEs. I know you all are doing 1.5, 2.0, but getting paid at 1.0. So, how do we do the good work, but how do we make this sustainable? And how do we continue to disseminate this throughout our state and our Rocky Mountain region? Truly, it's my pleasure and honor to work with each and every one of you. And I look forward to the weeks and months and years to come when we continue this work. I really appreciate your attendance, and your feedback is so valuable in informing our next forum. So please scan this QR code. You'll also get emailed a link to the feedback survey. Complete the evaluation, and respondents will be entered to win one of 3 $50 Amazon gift cards. So please do fill this out. What I find very amusing about the surveys, we get lots of great content and feedback, but the consistent one is that everyone loves the breakfast burritos. All right. Well, thank you all so much for coming. And I look forward to working with you all. Have a good afternoon.